If you've ever had questions about the thyroid gland, this video is for you. Hello everyone, I'm Dr. Miriam. I'm a board-certified family medicine doctor, and in this video, we're going to discuss all the questions you've ever had about the thyroid gland. We'll start by discussing what the thyroid gland is and the hormone that it produces, as well as what happens when there are high and low amounts of thyroid hormone. The thyroid is a gland that sits in the middle of our neck, below our voice box, but above our clavicles, which are our collarbones. It's controlled by a gland known as the pituitary, which sits right at the base of our brain. This pituitary gland produces many hormones, one of which is TSH, or thyroid stimulating hormone. This hormone, TSH, is what stimulates the thyroid gland to produce two different hormones, T3 and T4. T3 here stands for triiodothyronine and T4 stands for thyroxine. They're both produced by the thyroid gland, but T4 is often converted to T3 in various parts of our body, and T3 is actually considered the more active form of thyroid hormone. Once these hormones are released into the bloodstream, they affect various physiological processes, including energy levels, metabolism, and growth. This interaction between the pituitary and the thyroid gland is actually a very tightly regulated system meant to maintain normal amounts of thyroid hormone. It operates through a negative feedback cycle, which works like this. When T3 and T4 levels in the blood are high, this signals to the pituitary gland to reduce the production of TSH. This happens because high levels of thyroid hormones inhibit the release of TSH. On the other hand, when T3 and T4 levels are low, the inhibition here is reduced, leading to increased production and release of TSH. This stimulates the thyroid gland to produce more thyroid hormone. So as you can see here, this regulated system is really meant to keep the thyroid hormone in a very narrow and optimal range. And as you can imagine, any part of this process can be affected. If the problem arises from the thyroid gland, we refer to this as a primary issue. But if it's stemming from the pituitary gland, we refer to this as a secondary issue. And just so you know, the pituitary gland is regulated by another organ known as the hypothalamus, but to simplify things here, we're going to mainly focus on the pituitary gland as well as the thyroid gland. Now that we've covered the basics, let's now transition over to what happens when we have low thyroid hormone levels, also known as hypothyroidism. In a majority of cases, or 95% of cases, the issue here is a primary thyroid issue, meaning that the thyroid gland is not producing enough hormone. So the problem is within the thyroid gland itself. This can happen for many different reasons, including autoimmune disease known as Hashimoto's, iodine deficiency. Iodine deficiency occurs in some parts of the world, not as much in the United States because we do fortify foods like table salt with iodine. Thyroiditis, or inflammation of the thyroid gland. Thyroid surgery or radiation therapy. This is typically in response to a thyroid issue such as thyroid cancer or high levels of thyroid hormone, which we'll discuss a little bit later on in the video. All of these causes are due to a primary thyroid issue. In some cases, there can be something known as secondary hypothyroidism, which is basically where the pituitary gland itself is not producing enough TSH, which leads to the thyroid gland not producing enough thyroid hormone. So how does hypothyroidism normally present? Well, because the thyroid hormone is involved in stimulating the metabolism, hypothyroidism typically presents in a way that reflects a slowing of that metabolic process. Symptoms can include fatigue, weight gain, intolerance to cold temperatures, dry, thick skin, brittle nails, and sparse eyebrows, constipation, and in some cases, it can also affect the heart and lungs, leading to shortness of breath with exercise. Some women can experience heavy menstrual cycles, but in some cases, they can have very infrequent cycles or none at all. As you can see, the symptoms here can range widely and they can also present very differently in patients. Some patients can be very highly symptomatic and others can have no symptoms at all. How do we diagnose hypothyroidism? We do this by obtaining labs, and through the labs, we're basically looking at the hormone levels that we discussed previously to see if they're in a normal range or not. In a hypothyroid state, the thyroid gland is not producing enough thyroid hormone, and so if you checked a T4, that level is going to be low. As a result of this, the TSH is going to increase. This is because it's a compensatory mechanism to try to stimulate the thyroid gland to produce more thyroid hormone. So in this case, you're going to have a high TSH and a low T4. Keep in mind that this is due to a primary thyroid issue. If the issue is due to the pituitary gland, the TSH here is not going to be elevated. It's actually going to be decreased. This is because the TSH is going to drop since the pituitary gland is the issue here. And so as a result, the thyroid gland is not going to produce enough thyroid hormone. Once we've diagnosed the patient with hypothyroidism, the next step is to discuss treatment. The goal of treatment here is to return thyroid hormone levels back to normal. We do this with thyroid hormone replacement therapy, which is often given in an oral form of T4 known as levothyroxine. Levothyroxine should be taken once a day on an empty stomach, and because calcium-containing foods can help with absorption of levothyroxine, we often recommend that our patients take these pills with orange juice. Let's now switch gears and discuss the opposite scenario, which is where we have increased thyroid hormone levels, also known as hyperthyroidism. How does hyperthyroidism present? Well, here we can have a lot of different symptoms, just as we saw with hypothyroidism, but oftentimes the symptoms are going to be opposite here because the body's metabolism is going to be increased instead of decreased. Symptoms include anxiety, which we'll lump together with tremors and palpitations or an increased heart rate, weight loss despite a normal or increased appetite, heat intolerance, increased frequency of bowel movements, as well as shortness of breath. Now that we've covered the symptoms, what are the causes of hyperthyroidism? The causes here are mainly going to stem from the thyroid gland itself, so we're mainly going to focus on primary thyroid issues here. Secondary hyperthyroidism, which is where the issue stems from the pituitary gland, is very rare, and so we won't discuss this in this video. Causes of hyperthyroidism here include autoimmune causes like Graves' disease, which is actually the most common cause of hyperthyroidism. Other causes include thyroid nodules, which are small growths or lumps in the thyroid gland that produce too much thyroid hormone. And it can be one nodule or it can be several nodules. Because the thyroid nodule itself is producing thyroid hormone here rather than the entire gland, we refer to this nodule as a hot or toxic nodule. So when there is more than one thyroid nodule that's producing hormone here, we refer to this as toxic nodular goiter. Aside from these two causes, another cause is thyroiditis or inflammation of the thyroid gland. Notice that we mentioned these with causes of hypothyroidism as well. This is because when there is inflammation of the thyroid gland initially releases an increased amount of thyroid hormone, leading to a hyperthyroid state, but eventually that gland almost fries out and stops producing hormone, which then leads to hypothyroidism or low thyroid hormone levels. Thankfully, most of these situations are temporary and so they don't last forever. Another cause to keep in mind is when patients take too much thyroid hormone level, which is what we refer to as an iatrogenic cause, or a cause that's related to medical treatment. This is why it's crucial to monitor thyroid hormone levels closely to ensure that patients are taking the appropriate dose. So how do we diagnose hyperthyroidism? We again obtain blood tests and will typically find that the thyroid hormone level is going to be high, and as a result, the TSH level is going to be low. This is because of that negative feedback cycle. So when thyroid hormone levels are high, our body is going to try and compensate by producing less TSH so that we stimulate the thyroid gland less and produce less thyroid hormone overall. How do we treat hyperthyroidism? Well, the way that we do this can be a little bit more involved than with our treatment of hypothyroidism because we have more than one option here. We have medications, radiation therapy, and surgical interventions as well. And when it comes to choosing which treatment is most appropriate, it really depends on a few different factors, such as the patient's age, the patient's preference, as well as the severity of their symptoms. We'll start with medications, of which we have two different classes. The first class is our anti-thyroid drugs, which includes methimazole and propylthiouracil, which we abbreviate as PTU. These medications work by decreasing the amount of thyroid hormone that our body makes. The next class is our beta blockers, and these are really used more for symptomatic management because they can help with symptoms such as anxiety, tremors, as well as palpitations, which is where patients have the sensation of a rapid heart rate. Our next treatment option is radiation therapy, which is a permanent way to treat hyperthyroidism. Patients are given radioiodine in a liquid or capsule form, and this basically destroys much of the thyroid gland tissue. Most patients who take radioiodine end up with hypothyroidism afterwards, and so they end up requiring levothyroxine as a result. Our third and final option is a thyroidectomy, which is basically where you end up removing the thyroid gland through surgery. This is used much less often than our other two treatment options just because of the risks associated with surgery, but there are still situations in which a thyroidectomy is warranted. Some examples include when patients don't tolerate antithyroid medication because of side effects and don't want radiation therapy. Another situation is when patients develop goiter, which is basically where the thyroid gland becomes enlarged, and this can lead to compressive symptoms, making it difficult for patients to breathe. All right, everyone, I hope you found this video insightful. And of course, if you ever have any questions, it's always best to reach out to a healthcare professional.